ठीक है पापा, ओके स्टार्ट।
Okay. Today we will discuss some infections, pediatric infections, which may be due to some congenital infection from the mother or some pediatric illness. So one is very important is torch infection. Torch, Torches. Torch मतलब toxoplasmosis, rubella, cytomegalovirus, herpes, syphilis. So these are torch, Torches, torch. There are 5 diseases: toxoplasmosis, rubella, cytomegalovirus, herpes, and syphilis. So these take one by one we'll discuss. Now we come to the point congenital toxoplasmosis. Now congenital infection develop only when non-immunized mother develops pregnancy or infection less than 6 months before pregnancy. Less than before pregnancy if there is infection, or non-immunized mother develop pregnancy. Now, how we prevent this? We prevent by avoid exposure to cats and cat feces during pregnancy, and avoid raw undercooked meat. So these are the points where the toxoplasmosis may infect the person. So avoid exposure to cats and cat feces during pregnancy, and avoid raw undercooked meat. Incidence of transplacental infection is lowest in the first trimester. This is very important. Infection lowest first trimester, but the disease in neonates is most severe. Disease in neonates is most the incidence of transplacental infection is highest in third trimester after 6 months. But here the infant is not severely affected. So two very important points, that in the first trimester it is the incidence is lowest, but whenever there is infection, the disease in neonate is most severe. But in incidence is more on transplacental infection in the third trimester, but the infant is not severely affected. एक दूसरे का कंट्राडिक्ट है, कम है इन्फेक्शन फर्स्ट ट्राइमेस्टर में, बट इन्फेक्शन इज मोर सिवियर इन फर्स्ट ट्राइमेस्टर. थर्ड ट्राइमेस्टर मोर इन्फेक्शन rate, but child or baby is not severely affected. So in this case, there is triad of 3C. Triad of 3C is chorioretinitis, that is the most common, convulsion, and intracerebral calcification. Intracerebral calcification, in CT scan, there may be ring enhancement lesion, ring enhancing region. So intracerebral calcification. Other features may be hydrocephalus, microcephaly, microphthalmia, mental retardation, definitely. So these are the three triads of 3C: chorioretinitis, intracerebral calcification, and convulsion. Now, how we diagnose the case? Anti-toxoplasma IgE level in infant blood does not confirm, because maternal IgG can easily cross the placenta, so disappear by 6 to 12 months of age. Now, what are the serological tests to detect IgG? Number one is the Sabin-Feldman dye test. Most preferred IgE test and gold standard is Sabin-Feldman dye test, IgG, IFA test, indirect immunofluorescence. These are all things. Anti-toxoplasma IgM does not cross the placenta. Therefore, IgM is the test of choice for determining congenital infection. So, congenital infection determination is by anti-toxoplasma IgM. So, one is anti-toxoplasma IgA may have greater sensitivity for neonate compared to IgM assay. Now, what are the serological tests for IgA? So, number one is double sandwich enzyme linked immunofluorescence. This is important. Double sandwich enzyme linked immunofluorescence assay, IgA ELISA. It is better than double sandwich IgM ELISA for diagnosis of congenital toxoplasmosis. So this is important. Now, toxoplasmosis is very important, is that placenta, transplacental transmission, triad of the symptoms, and diagnosis. Now we come to congenital cytomegalovirus infection. Now, congenital cytomegalovirus infection is the most common cause of congenital infection. It leads to cytomegalic inclusion disease. It may be asymptomatic, but fatigue, hepatosplenomegaly, and jaundice is the classical triad of presentation. So there are three triad of presentation, just like toxoplasmosis, where 3C: chorioretinitis, calcification, and convulsion. Here in congenital cytomegalo, there is petechial hemorrhage, hepatosplenomegaly, and jaundice. This is the most classical triad of presentation. Other important, there may be microcephaly, periventricular calcification, IUGR, chorioretinitis, or maybe occur inguinal hernia. So this is important. So how you diagnose? The most common method of diagnosis is the detection of quantitative nucleic acid testing, QNAT, for CMV by polymerase chain reaction, PCR. So by PCR we can diagnose the case. In histopathologic examination, CMV infection cells contain large intranuclear and small intracytoplasmic inclusion bodies. Remember, large intracellular and small intracytoplasmic inclusion body, that is known as owl's eye inclusion, which is pathognomonic. So in histopathologic examination, the pathognomonic is the owl's eye inclusion, where the infected cell contain large intranuclear and small intracytoplasmic inclusion bodies. This is the importance of this CMV. Now, coming to the neonatal herpes simplex infection. This is not so important because patient, if there is any infection of the herpes simplex virus 2, only 30% by herpes simplex virus 1 infection. So most common herpes simplex virus 2. It can fatality rate exceed 60%, and if untreated neonate herpes. So infection is acquired by passage through the infected genital tract with birth. So genital leaks 50% transmission. So performed a cesarean section if mother has active lesion at the time of delivery. So this is not so important. Now, coming to the congenital syphilis, this is also important one. Congenital syphilis, there may be early manifestation or there may be late manifestation. Early manifestation appears within the first 2 years of life, often 2 to 10 weeks of age. It is infectious and resembles the manifestation of severe secondary syphilis in the adult. So early manifestation appears within the first 2 years of life. What are the early manifestations? Early manifestations of congenital syphilis. So there may be rhinitis or snuffles, that is earliest sign appearing 2 to 6 weeks after birth. So baby, maybe there is a running nose. So if there is a running nose, you must consider about congenital syphilis. Second is syphilitic pemphigus, vesicle, superficial desquamation, petechial, and later papillosquamous lesion, that is known as congenital metalata. Bone changes may be osteochondritis, so parrot pseudoparalysis, or periostitis. There may be thrombocytopenia and pneumonia alba, that is white lung. This is very important. Pneumonia alba. Jaundice may occur, anemia, lymphadenopathy may occur. So these are the earliest congenital manifestation of congenital syphilis. Now, what are the late manifestations? Which appears after 2 years. So early manifestation before 2 years, late manifestation after 2 years. And what are the features? Now, one is the interstitial keratitis. Interstitial keratitis, bilateral knee effusion, that is known as Clutton's joint. Bilateral knee effusion, periostitis, eighth nerve deafness, recurrent arthropathy, destruction of hard palate and bony nasal septum. So, destruction of hard palate and bony nasal septum. So, bony nasal septum is destroyed by the syphilis, and cartilaginous part is destroyed by the leprosy. These are the two important differences between leprosy infection in nose and this nose infection by syphilis. So, destruction of hard palate and bony nasal septum. Now,
Because
what
it's
are
very
the
excellent point to like differentiate between the both. It may be
yeah, that is very important, because in sometimes there may be asked that which part of the septum involved by leprosy and syphilis. So these are
Right.
two important differences.
Right.
One is
Even in the
bony, one is
these are one of the keywords जो बच्चे लोग अपने क्वेश्चंस में खोज सकते हैं कि हाँ देखो ये देख के बता सकते हैं कि हाँ मतलब
कि
पूछेगा
ये
कि
लेप्रोमेटस है और ये सिफिलिटिक है।
सिफिलिस है, हाँ। और ऑप्शन हमेशा दो में कंफ्यूजन होता है, चार
दो में ही
ऑप्शंस में
कंफ्यूजन होता
हमेशा दो में ही कंफ्यूजन
है। हाँ,
होता है, तो एक छोटा सा पॉइंट सब डिफरेंशिएट कर
सब
सकते
जानता है कि नेजल नेजल इन्वॉल्वमेंट होता है बोथ इन
हैं।
सिफिलिस एंड दिस लेप्रोसी। अब
हाँ,
कंफ्यूज होता है कि कंफ्यूज करता है कि लेफ्ट बॉडी पार्ट में हो रहा कि कार्टिलेजिनस पार्ट में हो
कार्टिलेजिनस
रहा
पार्ट में हो रहा
है। हाँ,
है।
दिस
ओके,
इम्पोर्टेंट।
चलिए।
Next is the what are the classical stigmata include Hutchinson teeth. Hutchinson teeth, if you see a baby of congenital syphilis, so there may be Hutchinson teeth. Now, what is Hutchinson teeth? This is also important. It is centrally notched, widely spaced, and peg-shaped upper central incision. This is important. Central incision, not the lower. So involvement of upper central incision, centrally notched, widely spaced. This is known as Hutchinson teeth. Second is mulberry molar tooth, 6-year molar with multiple poorly developed cusps. So mulberry molars, 6th-year molar with multiple poorly developed cusps. Saddle nose. Again there is come a saddle nose. So there is destruction of the bony part. So nose may be depressed. So nose is saddle nose. Saddle is also found in the leprosy. Saddle nose in leprosy.
यस, लेप्रोसी इट इज प्रेजेंट,
Yeah.
ऑल्सो
Saddle
प्रेजेंट है।
nose
हाँ।
also. Yeah, saddle nose. Severed tibia or tibia may be severed skin of the tibia.
हम्म।
Some raggedness होता है, wrinkle, radiation scar around the mouth. So these are the features of this sequelae of residual stigmata of this year. Now, what is Hutchinson triad? One is important is Hutchinson triad. Sensory neural deafness, interstitial keratitis, and Hutchinson teeth. These are three known as Hutchinson triad. So one is deafness, sensory neural, interstitial keratitis, and Hutchinson teeth, meaning that Hutchinson triad. Okay. So these are the infective parts, syphilis in nutshell, and other infection also. Okay.
Okay, but so basically, torch includes the toxoplasmosis by the Toxoplasma gondii. Then
Yeah.
कौन से others हो गया जिसमें सिफिलिस, हेपेटाइटिस बी, कॉक्सैकी वायरस, वेरिसेला जोस्टा वायरस,
No.
पैरोवायरस, B19 HIV हो गया, आर से रूबेला हो
Mm-hmm.
गया, सी से साइटोमेगालोवायरस हो गया, एच से हर्पिस सिम्प्लेक्स वायरस हो गया। सो देर आर मेनी ट्राइड्स जो हम लोग डिस्कस किए हैं, ट्राइड ऑफ सी, हचिंसन ट्राइड।
Yeah.
तो वी कैन लाइक कंपेयर कि लाइक इससे यहाँ से एक क्वेश्चन बन सकता है बहुत सिंपल वे में।
Perfect. Yeah. Mm.
राइट, तो उसमें जो क्लिनिकल कीवर्ड्स है वहां से हम लोग आइडेंटिफाई करके एक एक पॉइंट को हम लोग ये बता सकते हैं कि हाँ देखिए ये इसमें ये प्रॉब्लम है। डायग्नोसिस
Mm.
करना बहुत जरूरी है। मैटरनल इम्यूनाइजेशन इज वेरी इंपॉर्टेंट
Yeah.
उसको बचाने के लिए।
बहुत सारी केस में क्लिनिकली बहुत केस आता है जो बच्चे जब बड़े हो जाते हैं तो उसको हम लोग देखते हैं कि भाई उसका टीथ जो है वो नॉस्ट टीथ मिलता है उसमें। तो
हम्म।
उसको हम लोग अगर हम लोग डायग्नोसिस करेंगे तो हो सकता है कि उसको कंजेनिटल सिफिलिस मिले।
राइट।
सो these are the clinical importance of this Hutchinson teeth. There may be uh, this Hutchinson triad also.
हाँ।
Hmm.
हाँ।
And in herpes zoster, toxoplasmosis is not so very common, but
हाँ।
it may occur. But herpes simplex or herpes zoster is also important.
राइट, you the placenta
So
role of placenta is utmost important, maternal antibodies वो उनका जो।
IgG,
हाँ,
IgG antibody, they but IgM not cross the maternal placental
प्लेसेंटल
through
बॉर्डर
placenta.
बैरियर, हाँ।
Uh, so, so IgG is very important for immunological development. ठीक है?
इस साल
So
एक
these
नीट
are
में
the
एक क्वेश्चन तो आएगा पक्का, टॉर्च इन्फेक्शन से।
all. हाँ, यस, बहुत इंपॉर्टेंट है ये।
सही।
हाँ।
ओके।
ओके।
ओके पापा।